cornea subspecialty was definitely not an arranged marriage. It was a long-drawn love affair. During the post-graduation, you go through different subspecialties and you tend to develop an affinity towards a particular branch. So for me, cornea was very fascinating, although at that point of time, there were not as many procedures in cornea as what you see today. Corneal transplantation was the only major corneal surgery being performed, whether for optical or therapeutic. And excimer laser had just started, so that was again something very fascinating to be able to correct refractive errors in a very precise manner. I had good mentors, Dr. Prema Padmanabhan, Dr. G. Sithalakshmi and Dr. Srinivas K. Rao, who did play a major role in influencing me to choose cornea as a subspecialty. So I think the role of the mentor is also very important, which helps you decide as to what subspecialty you're going to choose. Right from my MBBS days, I was always more inclined towards a surgical branch because I find that to be more definitive. In the cornea subspecialty, corneal transplantation was something really gratifying. To see somebody come with an opaque cornea and to operate on that and exchange it with a donor cornea and restore corneal clarity and vision really made me look at it in a very different way. And I think that kind of influenced me to choose cornea as a subspecialty, and I decided at that point of time that yes, this is something that I would like to pursue a career further. So overall, I think it's the exposure to the subject, the mentors that you have, and with these two things in mind, you have to make up your mind as to what your future career is going to be in ophthalmology. Being a corneal surgeon, having the ability to make a person see better, especially when he or she has given up hope of being able to see someday, gives a great deal of satisfaction. I can remember in the early part of my career, one day I had a patient who came in with bilateral thermal burns, and the first look when I examined the patient, I thought that it's impossible to repair this eye because externally both the eyes look badly burned, and it looked like as if these eyes, you cannot possibly do any surgery to restore the eyesight. But after performing multiple surgeries and over 6 months to 1 year and using artificial cornea keratoplasty, we were able to restore 90% eyesight in one of the eyes of this patient. And post-operatively, with this new eyesight, when he looked at his family, especially wife and newborn child, whom he had not seen for the past more than 1.5 years, I think the joy both for the patient and his family members, it was priceless. I think it is these moments that really make you feel that yes, I chose the right subspecialty, and this hunger of fire has to be there in you. You know, when you choose a particular subspecialty, you should be able to give more than 100% to each and every patient. I think the key to success in cornea is basically that you should have a keen interest in the subject. You have to be passionate about your work, and you have to keep yourself updated with all the recent advances that are happening in the particular field of cornea and external diseases. Even though you may not have access to all the diagnostic equipments or the therapeutic equipments, it does not mean that you should not keep yourself updated. You should try and read up about them, because in future you may get an opportunity to use any of these newer equipments. And always you have to put in a lot of hard work. You have to have an inquisitive mind, and you have to be truthful to yourself and to your patients. It's a long road. after your post-graduation, so there is no easy way out. You need to have patience, you need to have support from your family, and you should be ready to put in long hours. Hard work definitely pays. You have to shed your ego, and in these modern times where technology has become the dominant part in your clinical practice, it may not be possible for you to invest a huge amount of money into your practice, buying all the necessary equipment. So look for shared practice, look for your colleagues who can get together, like-minded people, and I think that way you can ensure that you can give the best to your patients. In the field of cornea, yes, you need support from the eye bank, which is very vital. Maintain good relationship with the eye bank, and networking is very important. And in terms of surgical equipment, it's always better to buy some of the surgical instruments for your own use, because every time if you depend on the clinic or the hospital where you work, I think it may not be possible to get all the necessary instruments. So at least in my practice, I have invested my money to get all the necessary surgical instruments, because I think you do require these instruments to be able to perform a lot of complex corneal surgeries. It's important not to make a hasty decision in choosing a subspecialty. Often when you complete your post-graduation and having gone through different subspecialties in ophthalmology, sometimes you're able to make a decision and you know that this is the subspecialty that you're going to follow. And sometimes you are driven by what your colleagues want to do, or what the general trend is in the clinical practice, where everybody wants to be either a cataract or refractive surgeon purely from the business point of view. I think it's important that before you make a choice for your subspecialty, you should be very clear in your mind that this is the subspecialty that you want to follow. If you're not sure, take a year off, do clinical observership or do attachment with people who excel in that particular subject, get to know, and I think if you did that, getting exposed to that particular subspecialty, it would at least help you clear in your mind that yes, this is what I want to do for the rest of my life. And I think that's the key point that you should take into consideration. If I had to choose a subspecialty after my post-graduation, I think I would have loved to specialize once again in the field of cornea and external disease. In terms of doing your fellowship, it should not be something that you just do for getting a degree or a certificate saying that you have completed a fellowship. If you want to do a particular subspecialty fellowship, it's important that you choose a center or an institute which has good exposure to the subject, a fair number of patients, and good opportunity to learn from the experienced surgeons there, and also the opportunity to independently see and treat patients. I think at the end of your fellowship, you should have enough confidence that if you go back and you start your practice, you will be able to offer a good service to your patients.